as possible when they are about to begin. Thank you, Nylea. I'll thank you too, so you don't feel left out. And thank you, Taylor. I'm plugged into a mult box, so you're not going to hear me. I can't talk back to the station.
They're gonna have your music and they're gonna be like, we're going live. The hardest part of working nighttime is waiting for it to get dark. Just a wasted time.
Mic check, 1, 2, 3, mic check.
Got it.
I can say I can hear myself over your phone, so we're good. All right. You guys all good, everyone? Mic check, 1, 2, 3. Mic check, 1, 2, 3, 4, 5. 5, 4, 3, 2, 1. Everyone good? What was that?
Should be on the radio.
Ha! Don't know about that, Pete.
Oh, come on, I'll train you. That's what I've heard.
Literally, the balls went up.
I like to play out.
I kept it. And honestly, that's how it was sort of. You guys did it, yeah.
The reason I love playing in Florida is because
killing it all summer, you know?
Fake act like you're like nodding your head.
No paddle.
The brown one.
But again,
How do you do?
literally shooting the same shots I got the other night when I was out here. I was doing shot for shot pattern.
Look up when you're writing
Started for real.
Oh, it's about to start? Oh.
What is she wearing? Oh, got you.
Still here.
Really? That's how she
Everyone's set up? Good to go with audio? Yeah, that's good. All right. You go,
All right, everyone, one final sound check. Make sure everyone's good. Mic test, 1, 2, 3, 4, 5. Give me a thumbs up if you guys are good. Thumbs up. All right, guys. Steve?
This is Peter Samore's 30-second warning that we're about to start.
1,000 thank you, Steve Elliott.
All right. Good afternoon, everybody. Thank you for joining us out here at State Farm Stadium, our first vaccination site. Today's announcement is an exciting step forward as the state and our partners work to get COVID-19 vaccine into the community quickly and widely. We anticipate more and more vaccine reaching Arizona heading into April, which is making it possible for us now to expand prioritization. We have been flexible and nimble throughout while expanding the availability of state sites to vaccinate large numbers of people rapidly. As we look toward getting more and more vaccine, and as the demand for appointments among currently prioritized groups continues to decrease, this is an ideal time to make vaccine available at all of our state-operated sites. As of Monday morning, there were still 58,000 appointments available from Friday's release. Arizona has done a great job at using all of the vaccine available to us, and this change helps us keep that momentum. The change also applies to federal pharmacies, or federal programs for pharmacies and federally qualified health centers. Counties can still sub-prioritize within each of the groups, so you'll want to check where your county stands. However, most counties, or some counties, have moved to prioritizing their general population. As of this morning, doses administered in Arizona was approaching 3 million, and individuals with at least one dose was approaching 2 million. Meanwhile, more than 1.1 million Arizonans have been fully vaccinated. At least 3 states are already vaccinating all adults, and several others are set to make the change. And as you know, President Biden has said vaccination will be available to all by May 1st. The state and our county partners are committed to distributing vaccine equitably. In fact, a recent CDC report rated Arizona as one of the best in the nation for getting COVID-19 vaccine into vulnerable communities. ADHS is expanding our targeted outreach among underserved areas. That will include our disability community, so we will be working with our partners to get vaccination out to those communities. We will also be launching public service announcements and promoting vaccination to our underserved populations and to the general public. And with that, I'm happy to take any questions. Hi, Cameron.
So can you explain the factors that went into this decision, specifically on demand and supply? What are you expecting at the end of this month that will make such a significant difference on the amounts of supply that you're getting by the end of the month compared to what we're getting now? And you could talk a little bit about those numbers, and then talk about demand too, because it's a balancing act, right? So
right.
If you could expand on that a little bit.
Yeah, absolutely. So we want to keep the forward momentum going with our vaccinations. We were actually a little surprised that we still had that many appointments left, and that was at every state site across the state. And so in order to make sure that we're utilizing our resources efficiently, what we wanted to do was open it up to everyone who was eligible. When we were going to open it by age categories, what we identified was that we were already meeting a large portion of those with chronic medical conditions that put them at higher risk. But because of the age category, we weren't able to vaccinate those that lived with them or worked around them. This way, what it'll give us the ability to do is the ability to vaccinate entire families at the same time and really use our vaccination and the pods, because what we were noticing was people were able to find earlier appointments and canceling out here, and almost 3,000 a day. So we really want to be able to utilize this efficiency. We do expect to get increased amounts of vaccine starting at the last week of March, beginning of April. So we're excited to see what that allocation will look like for this week, but it's supposed to significantly ramp up through the month of April.
What are we getting now? At last check, I think it was around 300,000 total doses across the 3 major vaccines. What will that hopefully go to with that next ramp up? What will that look like?
So what we're hearing is that they're going to increase it by several million each week over the next few weeks. So we get about 2% of that. So we're hoping that what that would give us is about 40 to 60,000 additional doses a week.
Every single week. And when it comes to demand, how are you weighing what you know when it comes to data? Are you using data to confirm demand decreases? We already knew that there would be a significant portion of people who not going to get the vaccine. They've chosen to not get it. They feel that that's the right not to get it. How much was that also play into this decision?
So when we looked at the age groups, what we anticipated was about a 55 to 60% uptake in each of those age groups. We anticipated actually having more 55-year-olds that were interested in getting vaccinated, so that's why we were surprised that we had such leftover appointments this week. So if anybody's looking, you can go to podsvaccine@azdhs.gov or call our call center to get those appointments.
Obviously, some folks are going to be a little worried about the competition out there. What do you have to say to them? How do you make sure that, like you said, those vulnerable populations, those who might be disabled, those who might speak a different language, who don't have as much access, how will you ensure that they don't get left behind when we have a huge swath of people who might be interested? And what's the size of the population left in this group? I'm curious, of the 16 plus, what's that population look like?
So we anticipate that there's about 1.8 million Arizonans that are under the age of 18. So million total. We've vaccinated almost 2 million with at least one dose, so that leaves us with about 3.5 million. If you anticipate that only about 55% are going to want to take the vaccine, we're probably looking at 1.5 to 2 million. That's just rough back of the napkin math. What we will do for those specialized groups, like our individuals with developmental or intellectual disabilities, we'll be working directly with our partners at DES and with some of our vaccination events specifically for them, or potentially reaching out through their health plans to get them vaccinated. For some of those special communities, we're working with healthcare providers that are trusted sources in those communities through our county health departments to make sure that they're offering community-based vaccination sites in their area. So we know that transportation's a barrier, we know that language is a barrier, and so we'll be taking the vaccine directly to them. I think a lot of the people who have already wanted to get vaccinated have gotten vaccinated, because they still could qualify as healthcare workers, as teachers, those types of things. And so I would imagine that some of it has to do with vaccine hesitancy, although some of it may just be we've already vaccinated those individuals. So those are all great questions. We know that there were certain phases where people, you had phase 1, which is there's so much demand and very little vaccine. Hopefully we're starting to get out of that phase and into phase 2, which is the demand. Phase 3 is when the supply outpaces the demand, and then that's when we're going to be you'll see our messaging change. So it's today, right, Steve? Our PSAs. you'll see starting today that we've got PSAs running. Vaccine is safe, it's effective. When it's your turn, get it, because we want people to start thinking about that, but it'll probably still be a while. So that's one of the things that it's so important to get it to where like need to travel by car. So we have the ability to vaccinate about 12 to 15,000 people here. We've been doing between 8 and 10,000 vaccinations. What we've been doing is, as we identify cancellations, we've been opening them up to our call center so that the call center has appointments every day that they can fill into. But we've been getting quite a number of cancellations. As many as 3,000 is what my team has told me, yeah.
Do you think that's just because sometimes people will like look at a pharmacy that can get them in earlier?
And I think that that's one of the things that going to this new weekly date release will help. You know, when we were scheduling appointments for 2 to 4 weeks in advance, people were able to identify like a pharmacy nearby that had it, and then they would either cancel or no-show. Now, one of the things that they do try to do at these sites is, because we know we've got a certain amount of no-shows or cancellations, they would do the +1s and make it eligible. Well, now everybody, you know, as long as we have the vaccine and the appointments, everyone in the car would be eligible for a +1 as well.
And you mentioned the PSAs. I mean, are you concerned that we might not reach herd immunity given especially 58,000 appointments? And maybe there's more hesitancy than, you know?
So I think that that's always been a concern of ours, whether or not we would reach herd immunity. You know, we anticipate that we'd need around 70%. That would be our goal. And so, you know, based on our surveys that we did prior to the FDA reviewing the data, we knew that 55 to 60% at that time were willing to take it. So we've known that our work is cut out for us to get all of the people vaccinated that we need.
And then just 2 more questions. One is, was this a decision of feedback, or was it you and the governor, or made this decision?
Yeah, so when we met with VAPAC the last time, they had approved us moving down in the ages unless demand indicated that we should move more rapidly. So we had said about the 55%. When we looked at the appointments, this was a decision that my team made the recommendation to the governor's team that, you know, with 58,000 appointments still available, and knowing that we've got a lot of individuals that come with family members and that this was a good time to just open it up.
So was it VAPAC?
Not to move directly to 16, but to open it up as we saw based on demand.
And then the last thing is, when can people, I had a few readers who try to reserve already, and they're in some of the younger age groups, and they said they were having trouble with 16 and 17-year-olds. When can people actually start, you know, in those age groups start reserving?
Yeah, so they should be able to start reserving Wednesday morning at 8 a.m. Just to let everybody know, Pfizer is the only vaccine that's approved down to age 16. So at any state-operated site, those that are 16 and above can get vaccinated. The Moderna and the Johnson & Johnson or Janssen vaccine is approved for 18 and above. So just make sure that if you've got a 16 or 17-year-old, that they're coming to a site that's doing Pfizer.
Great, thanks.
You're welcome. Hi, Dylan.
So, at what point, I know you said that it's like still around 55% of people still want to get vaccinated. I know your goal for set higher close to 70%. So first, like, how do you reach that goal at this point? What are you seeing to help get those percentages up? How many more people can get vaccinated?
Yeah, so we were seeing pretty high vaccination rates at the beginning with our healthcare workers and our 75 and above. We knew that as we got down farther in the ages that it would be harder to convince people to get vaccinated. And so we're going to continue to provide education, to survey the community, but also meet people where they are, so that you know, if it's a if it's due to language barriers or transportation barriers or technology barriers, that we're in their community. But we're also going to be working with community leaders, and that's some of the things that you'll see in upcoming PSAs, is working with those leaders to encourage people, to have them encourage people to get vaccinated.
What's going to be done about these like underserved community areas? Like I know there was 85009 was the first time that you guys had like taxis to help them reach. What's being done for those communities of people who aren't being able to get the vaccine as well as other areas?
So we're expanding that pilot into the South and Central Phoenix area. So we'll be doing those same type of activities, the targeted high-intensity communication. But instead of like bringing them out to a mass vaccination site, we're working with healthcare providers in the county health department to get vaccination clinics right in their community. So very similar to what we did with testing, where we had community providers that were trusted provide kind of those wraparound services, but in addition to testing, now we'll take some of those same sites and add vaccination to it as well.
At what point do you think you'd be comfortable telling the governor that it's time to end the state of emergency? Like how many people need to get vaccinated? What do COVID positivity numbers need to look like? What are you thinking?
So our COVID positivity percent positivity is trending down. It's looking really, really good. We continue to see declining case rates. With the vaccination, I don't know that we'd have a number. We'd want to see continued demand. So it's hard to tell. It's kind of, there's not really a set formula to when we would say that about the emergency, because there's other things that the emergency allows us to do, like to continue working with DEMA and to draw down funding. So it would depend on where we were and how those things that would be affected by it would be affected. So,
Last question.
yeah.
Can you just talk a little bit about what these PSAs are going to be, where they're going to be targeted, and just whatever other information
Yeah.
is going to be in them?
So what we'll be doing is we've got Spanish PSAs and English PSAs, and so we'll be targeting them through social media, really trying to get the general population. It will go out to the general population for just general awareness and information, but then we will also be social media targeting like some of the Spanish PSAs to some of those underserved areas so that they can see it from one of their trusted leaders.
So we've seen when new age groups get opened up that the website gets flooded and there are some technical problems. So potentially millions of more people are going to be able to sign up Wednesday morning. How prepared is the website this time around, or is it going to be the same type of messaging all day? Keep trying, keep trying, keep trying.
So we continue to make enhancements to our website. This time as people go through, they won't be, their appointments will be saved, so they shouldn't be able to have them snatched out from under them, which will be a big, huge help, and we've heard a lot of comments on that. What we anticipate, we won't be releasing a large number of appointments. It'll be what's ever available from this most recent release. But then on Friday we'll release more. So what we would encourage people, we continue to have a team that kind of stands on to make sure that we've got the adequate number of servers and that it's processing okay. But we would say probably for the next 2 weeks anticipate high demand, and then it will likely slow down after that.
So is that try every day or try every Friday?
So here's what I would recommend. Definitely try every Friday, because that's when the majority of the appointments are going to get released. If you are free and you're looking for something to do and you need to get vaccinated on a same day, you can call our call center. I would recommend calling like right at 8, because we release new appointments to the call center every single day.
One of the incentives for people to volunteer at this site was that they would get a vaccine also. Are you worried that this would plummet volunteer numbers, and would that affect this site because you wouldn't have the manpower?
I think we've had such a good, our volunteers have had such a good experience out at the sites that hopefully they would continue to return. We have waiting lists of people that want to be volunteers and businesses that have reached out. But if we had to, we would just work with ASU Assure to get contracts to pay people to be out here. So it shouldn't affect the operations of the site. We would just transition from volunteers to